First of all, I would like to thank the organizers for inviting me for this presentation. I will take you through a journey about the progression of the story of stroke in the MENA region. This will be my agenda. I will overview the history of stroke service in the MENA region, the steps taken to improve the service, the Saudi, the Emirati, and the Egyptian models. The Middle East and North Africa consists of 17 countries and extends, of course, from Iran to Morocco, with a population of about 400 million, with the absence of good quality of stroke care and even absence of literature about the incidence, the prevalence, and the exact burden of this devastating disease. As we all know, the burden of non-communicable diseases is found to be on the rise, especially in the developing countries in recent years. And definitely in our region, these incidents will represent a great burden, either on the mortality or the morbidity. Unfortunately, stroke care in the region is still in its infancy, despite alteplase is being approved more than 2 decades ago. And despite that this treatment is available, no much steps were taken to the best of our knowledge before the year 2012. There was less than 10 centers across the whole region which can provide this service of thrombolysis in a proper way. And definitely the rate of thrombolysis was less than 1%. It was in the late 2014 that a group of neurologists from the region decided to come together to improve the level of stroke service in the region. And what started as a small initiative actually gained a great momentum across the whole region. As we all know, Egypt is the most populous country in the MENA. Started with just 2 stroke units in its capital, Cairo. Today, we have more than 80 stroke units. Still, some are not well qualified, but still the number is on rise, and the number of comprehensive stroke units actually is improving gradually. In addition, there is a strategic political alliance with the government to provide this service free of charge and to be reimbursed through the MOH. The Kingdom of Saudi Arabia, with over 30 million population, only had 4 centers offering thrombolysis in the beginning of the year 2013. Now there are over 50 centers with at least 10 that are comprehensive units with facilities for thrombectomy. In Saudi Arabia, stroke was set as a national priority together with the myocardial infarction and trauma in the acute care model and with healthcare transformation. And they started to classify the stroke service, whether it's stroke-ready hospitals, primary stroke centers, or comprehensive stroke centers, and they started to look for accreditation. Again, they started to develop the clusters and networks across the whole region to provide the service across the whole kingdom. Also, there is a great interest in building and initiation of the National Stroke Registry. In the United Arab Emirates, which had only 1 stroke center in the beginning of the year 2013, stroke service expanded tremendously, especially in the 2 big Emirates, Dubai and Abu Dhabi, and now has almost 10 stroke units, with at least 4 of them being comprehensive units. Similarly, countries like Kuwait, Bahrain, Lebanon, and also North Africa, countries like Tunisia and Algeria, they have gained momentum and expanded the stroke services in these countries. Maybe this graph can illustrate beautifully the expansion of the number of stroke units and also the services across the region in 5 years, from the year 2013 till 2018. We can notice the number of stroke units the thrombolytic centers, the thrombectomy centers, the number of stroke specialists mostly tripled or quadruplets, with neurointerventionists starting also to have many in our region. But how this happened? Actually, there are 4 landmarks which contributed to this great progress in this stroke service. The SITS registry, the MENASO organization, the ANGELS initiative, the cooperation with the American Heart Association, American Stroke Association. I will touch upon each landmark rapidly. We all know that SITS is the biggest registry across the world, with more than 80 countries contributing and more than almost 200,000 patients already registered. The MENA region started to be interested in this registry almost 10 years ago, and they started to enter the data, and the data actually is building rapidly. Of course, this data is encouraging people for publications, and also, as I will explain later, with the ANGELS, they started to apply for awardation to get the different awards of the ANGELS with the help of the organizations like ESO and WSO. It was in the MENA Stroke Organization, it was in the late 2014 that a group of neurologists decided to come together to improve the level of stroke, as I just explained. Despite that, the MENA organization was formally approved in 2018 by the Dubai Chamber, but its activity actually was going on since 2012 with almost yearly Congress in different countries across the region. The last one was virtual or hybrid actually in Cairo, and now we are already in the virtual conference in Bahrain, also under the umbrella of the MENASO. So it's a great activity going on yearly, with a lot of workshops and also a lot of activity and education program across the region every few months. So this is helping in educating the young neurologists and in supporting the educational program and increasing the awareness among the population across the whole region. The third landmark is the ANGELS initiative. ANGELS actually started in the Middle East and with the idea to promote for improvement of the stroke service, together with, of course, the support of the WSO and ESO, and spread across the whole region and across Europe and across the whole world. And it's becoming a very important organization to improve the stroke service through helping the different stroke centers to improve the service and to apply for awardation according, of course, to a specific criteria. You know, the different awards, the gold, the platinum, the diamond, and these awards actually encourage many of the stroke centers to improve the service and to apply to be awarded. Lastly, and this is a very important step, the MENASO organization had a memorandum of agreement with the AHASA to be responsible together for the accreditation for the stroke units in the Middle East, and also for the educational program, a continuous educational program. And almost in each Congress of the MENASO, we had a session, joint session with the AHASA, like we are having this Congress, also a separate session with the AHASA. And this is very important collaboration, is encouraging and giving momentum to the stroke service across the region. Being Egyptian, I will give some overview about our model in Egypt and our experience, how we managed to improve the stroke service. Before 2015, despite that we have eminent physician, long history of local research, but we didn't have any or very few international application with the deficient documentation without any database. And of course, the number of thrombolysis rate was less than 1%, and the drug alteplase was not covered by the MOH. So we decided at that time to see why you are not giving the thrombolytic therapy to the patients. And we discovered that the problem is the drug was not available since it was rarely used. This represents almost 50%, and the other 50% was due to some logistic problems in the hospital, causing this in-hospital delay. The resident doesn't know how to act and what is the pathway and what are the steps and so on. So we decided to change that in our hospital. The drug became available through donation, and we put a training program for the residents. And it was very important for any residents to pass the exam, to be well trained through this program. And it was implemented. This is actually our manual for the residents, and we can see, of course, the inclusion criteria, exclusion criteria, and the residents know by heart this algorithm, how to manage the stroke cases coming in the window in the ER. And this algorithm actually was put as a big poster in the ER, so everybody knows how to manage these cases. After 6 months, the rate of thrombolysis increased from 13% of those patients coming in the window in the hospital to more than 95%. And this tremendous improvement actually was just by making the drug available and by changing the pathway and implementing this knowledge across the whole residents and across the whole staff working in the ER, so they should know by heart how to manage these cases. And we didn't forget to publish this experience in the International Journal of Stroke. Next year, we give the file to the Minister of Health that this is very important and this is a life-saving drug. And actually, this is a meeting with the Minister of Health. He approved the treatment to be under the MOH free of charge in any hospital for those patients coming on emergency basis in the golden hours. And we spread this knowledge across the stroke chapter of the Egyptian Society of Neurology, Psychiatry, and Neurosurgery, with a representative from each university. So all the university hospitals are now providing this stroke service, and they are having stroke units. Most of them also, they are doing thrombectomy. And also in many of the hospitals of the Ministry of Health, there is a service, this service is provided. And in the next year, in the year 2017, in the same Congress, like the MENA Congress, which was joined with the Egyptian Stroke Conference, the Minister of Health attended this conference and decided 3 important decisions: the establishment of National Stroke Committee, the establishing the stroke unit across all MOH hospitals in Egypt, and that the SITS will be the Egyptian Stroke National Registry. And actually the SITS now is having more in Egypt, is having more than 8,000 patients. 1 year later, thrombectomy again was announced to be free of charge under the umbrella of the MOH. And this was a giant step because, you know, of course, it's quite an expensive procedure. And the stroke units spread across Egypt. Now we are almost approaching 100. At least we are having between 15 and 20 comprehensive stroke units. And we started to have awardation. This is in the ESO conference, in which we are having our 2 centers in Ain Shams University are having Diamond Awards. And also we applied for the certification. We have in Ain Shams University, the only 2 stroke units in Egypt which are having the German certification as a comprehensive or as a stroke center. As we can see, the number is still rising, and we are approaching now almost 100. So it's late after more than 20 years, but actually in the last 5 years, we achieved a tremendous progress in Egypt and across the whole region in improving the service of stroke. So to conclude, stroke service improved dramatically across the MENA region in the last 5 years. The main reason behind this were MENASO, Angels Initiative, SITS Registry, and lately the cooperation with the AHA, ASA. As we always say, it's always better to come late than never. After 20 years of the approval of the Altiplase, we moved fast. And I guess if we go like this in the coming years, we can provide good stroke service for all patients who will need this service. Thank you. And if there is any questions, I guess I will be ready to answer.